look over my career, we've had these discussions and debates, whether it be switching from mace to pepper spray, whether it be switching from revolvers to semi-automatic pistols. Each one precipitated by something unique and aggravating in the environment in which our officers have to work. I think it's incredibly important, and I want to leave just on a quick note, that we have trained probably one of the best training departments in the country relative to dealing with and identifying issues relative to mental health. In 2001, we began the initial 40-hour training for each officer in mental health awareness, de-escalation skill building, and that went from 2001 to 2010. That was done in conjunction with the mental health board, and so 983 members of our department were trained and provided that training. In 2010, I believe, then Chief George Gaston came on. We began having a discussion about adopting a different model, adopting a team approach to dealing with individuals in crisis. We looked at other agencies, we looked at Memphis, who had the model, they've been having it in place for some time, and we partially adopted that model. Today, as I indicated, we, on top of the 983 members of our organization that were trained over the last 10 years, we've trained just in this last year 118 of our own and some 10 of other agencies. The work that goes into each one of the training is significant. We've got over a dozen different entities, both public and private, involved in each one of the trainings. And so therefore, the coordination of those efforts has to be done in line with the ability of each one of those organizations to provide the in-kind services and not to overtax. And as a result, we're doing that once a quarter. I think it's incredibly reasonable to do that. By the end of this year, we're anticipating another 160 officers to be trained in the patrol. So we are definitely moving forward. We're continuing to build alliances. The very folks who are part of this discussion today are intricate members and supporters in moving the CIT forward. I leave with you with this. This is not about, in and of itself, mental health. This is about all officers engaging with people in our communities whose behavior constitutes a threat to the public, and the ability of our officers to stop that. Each and every one of these instances where the former chiefs who brought this issue to bear, it's been precipitated by a tragic event. And quite frankly, our officers, we want to stop having to use that. We'd rather not. I mean, if words worked all the time, then a large percentage of our calls for service would not emanate from the very professionals in some instances who are capable of dealing with the aggravated behavior of the person who constitutes the threat. So it's about dealing with the aggressive behavior of folks that is threatening to the public that we have to contend with, and not necessarily, not at all responding to any particular community, but all communities in which violence is an issue. So with that said, I thank you for having us. The chief is moving forward with levels of community engagement that are going to follow in January, February. He's marching all the way up into April. We're outreaching to the various communities, hearing the different neighborhoods about the different issues. We continue to look at the options that are available in terms of less lethal weapon systems that are less than our firearms. And we'll definitely get back to you and be open to further discussion of the issue.
Thank you, Commander Lee. And what I'd like to be able to do is, we had a hearing today was really on the use of tasers, but as we were preparing for this hearing, it seemed like there was a lot of work the city is doing, the police department is doing around the crisis intervention team.
Sure.
And I'd like to go a step further in the new year is to look at that and see how we're hitting our stride in the crisis response within the department and putting this team together and the training that is really necessary for us to do the kind of policing we know that can de-escalate crises that people find themselves in. I think I see it separate from the issue of tasers and electronic control weapons. It almost seems like we're going backwards by training a team to be able to de-escalate violence and mental health crises, and at the same time equip them with a tool that, if used, I think could have a detrimental effect on de-escalation, and also open the door for greater usage within the department. That's my personal concern, and it's one that a lot of people in San Francisco share. I think you can go out on the road in San Francisco and you find a lot of people who can probably give license to the department to move forward on that. I think as moving forward, I think it's really important to look at the part of San Francisco that probably experiences the greatest concentration of mental health crises that we have. And that would probably be in the South Park, Tenderloin neighborhood, often in District 6. And work really well with the community to see what you're hearing from them on the issue. I think that's something that's really critical moving forward. I worry that we're moving too quickly looking at how we can employ Tasers when we haven't done the work on developing the crisis response that we can do in the department. And I worry that we're moving towards a lethal clip that we don't need to reach at this point because we haven't put the resources into that training. And that's why I wanted the hearing moving forward in the new year. And I have concerns about that we move to a pilot program for Tasers, that'll expand. And I do give a lot of credence to the studies that come out that talk about escalation and injury and harm to people who get tased when Tasers become employed, that there's actually a greater instance that studies have found in officer-involved shootings and uses of Tasers. And that is a great concern. I'm not the decision maker on this. I can only express what my concerns are. But I hope that the police commission and the command staff really consider well the concerns that have been expressed here from the community and from members of this committee.